Good morning. My name is Jennifer LeVine, and I am a physician assistant and health consultant here to provide education, support, and community for those dealing with prostate cancer. This video is a brief video of the things that I look for when I walk into a room for a patient who just underwent a radical prostatectomy for prostate cancer surgery. Usually surgery to remove the prostate gland for prostate cancer surgery is done using a robotic approach, meaning this is a minimally invasive way to remove the prostate gland. And most often patients can expect to stay in the hospital pending there is no complications for approximately 1 night. Due to the minimally invasiveness of this procedure, there are small incisions, thus patients have less pain and better recuperation with these robotic surgeries and this robotic prostatectomy. So when I walk into the room on post-op day 1, after a robotic prostatectomy, there's a few things that I look for. And number one, I obviously look at the patient's abdomen because these are most likely where the small porthole incisions are placed by the surgeon. And I obviously want to make sure that these look fine, that these are not draining, they're not red, and they're not too extremely painful for the patient. I'm obviously looking for signs of infection that a simple a cut to the skin possibly can produce. So I'm looking at the incisions, I'm looking at your abdomen. The abdomen is always a very important thing to look at after any type of surgery, especially robotic surgery. I'm looking to see if your abdomen is soft. A lot of times, as I mentioned before in previous videos, general anesthesia and or surgery in general tends to slow down the bowels. So often the day after surgery, the bowels or the belly can be somewhat distended due to slowing of the gastrointestinal tract. So it's important for me to look at the abdomen. Also, if anything serious is going wrong, like major internal bleeding, the abdomen is always important because if you can imagine, if you are bleeding internally, your abdomen starts to fill up, and obviously that can be seen on physical exam. I'm looking at your lower extremities, your legs. I want to make sure that there's no swelling in them because after surgery there always is a risk factor for a clot, a deep vein thrombosis. So it's important to walk and ambulate as much as you can after surgery. And I always encourage, when able, on post-op day 1, to get out of the bed and into the chair. That allows your body to start moving and hopefully will help with the entire recuperation period as well. So this is just a brief video of the few things that I think are important for a provider to assess on post-op day 1 after a radical prostatectomy. Usually people are discharged later in the afternoon pending they're able to tolerate a regular diet. It's not often required to have a bowel movement before discharge, but we usually do like to see our patients at least passing some gas, so that way we know that the bowels are beginning to wake up. So I hope this video served you. I hope that you learned a little bit as to the important things that a provider or surgeon looks for on the first day after prostate cancer surgery. And please return to my YouTube channel, again, for education, support, and community for those dealing with prostate cancer. I'm Jennifer LeVine, and thank you so much for tuning in. Take care. Bye-bye.